some of you think healthcare is a right. At least two brave people in the room. Free, okay, free. More? How many would identify themselves as being conservative in this room, politically? How many would describe themselves as being liberal? Okay. How many would describe themselves as being libertarian? You guys understand the difference between liberal and libertarian, right? I hope you do. If you don't, you should learn it. You guys, your go-to resource is Wikipedia. I contract it, right? My go-to resource. I'm not afraid of social media, right? So, okay, good. So we have a good feeling, good cross-section on it. So I assume, aside from free food, at least 3 people in this room are interested in PPACA. Good. It's about what it's worth. So let's see if we can get this to go. I just shut it off. Hey, Mark, what did I do this thing? Oh, there it is. Okay, there. So here's a live disclaimer. I am a professor at OU. I'm also still in the military. Nothing I say has anything to do with the U.S. government or OUCOM, HCOM. I graduated from OUCOM. You guys graduated from OU-HCOM. These are my opinions, okay? And I get accused of dealing in jargon by my professional peers, and I like popular culture, right? Because I'm an analyst. By training, I have training in strategic analysis. I look at atmospherics. I look at what trends are, okay? Journals are usually 1 year to 2 years behind in terms of how that works. I want to know what's going on now. So forgive me, I do have some references for you. You guys can look at it. I'll give you my presentation anytime you want to look at it. But the fact of the matter is that you will see what's the current state, right? PPACA. So it's important. Why do I care about this? Well, I'm probably one of the few professors, and this isn't tooting my own horn, this isn't a lack of piety. I'm one of the few professors who have actually treated patients in at least 6 countries with socialized medicine systems, single payer systems, universal health care, okay? I really understand this stuff. I understand how things change from the United States to other countries. I understand what happens in those countries when people can't get access. I understand what it's like to try to save a person that the system would have destroyed or tossed out in the trash, okay? That story was published about me in 2004. You guys are probably still in grammar school. But this is about a little girl who had a stable condition in the United States of America, would have been left to die in Iraq. Socialized health care. And I'm not saying that pejoratively. I'm saying in the country of Iraq, she would have been said, we're not going to take care of this. So I pushed the envelope. I got in a lot of trouble from our government over that, some of the levels of it. I got in a lot of trouble from other people for that. But my job is to help take care of people with the resources I can find, right? So I do need to care about individual rights and liberty. I care about human beings and them getting the best care they can. I learned to have a healthy distrust for experts and the smartest people in the room. And I know about fighting bureaucracy very intimately. At one point I was told that I wanted to save every child in Iraq. I brought that child to the hospital, a U.S. hospital, and I brought her there, and all she needed was a little bit of antibiotics and some oxygen. I didn't have pediatric treatment, I didn't have pediatric masks. And I was accused of wanting to save every child in Iraq. And I said, I just want to save this one. It's a very myopic view of the world for the person who did it, who told me categorically I would not be able to bring this child back to the United States. But I knew better. I knew that there were resources in the United States. I had already talked to U.S. Senator, at that time Senator Byrd. On my side, he's deceased now, but Senator Byrd, no less than Secretary Rumsfeld, signed her parole papers to get her in the United States. So networking is important, right? If you know people, you can get things done. That's what you should remember in medicine. So comparison of lives, I told you I like to state strategically. I want to show something to you, right? This is an important thing to remember about how big a state gets and how the best care that can be delivered is local care, and the best solutions that can be found are usually locally derived. A lot of people show up and say, you know what, I know what's best for you. But the person who's best for you is you and your local community. You each have different distinctive needs and issues. The Soviet Union at its peak had 293 million people and about 9 republics, 9 times over 15 republics. We've got 54 different constitutions that are part of these United States and 316 million people. It's very hard to manage that at a single point. If you don't think there's different cultures in this country, you're mistaking yourself, because I guarantee the person who lives in South Central Los Angeles has a markedly different life experience than the person who lives in Oshkosh, Wisconsin. Okay? I've been in rooms where I've listened to people without them knowing who I am, because of course I don't speak with an Appalachian accent, because I'm a Californian by birth, right? Well, I'm Oregonian by birth, Californian by raising, But people thought that I was sophisticated because I was from California, and I explained, no, I'm really Midwestern. I'm an Appalachian. After they said all sort of pejorative things about hillbillies and toothless wonders and the unenlightened folks that are living, west of the Hudson River. And I had to disavow them with their misconception of how things work. So just remember, don't trust the smartest people in the room. Most of the time they're not as smart as they think they are. Including myself. I humbly admit. Okay, so let's review the background of PPACA report. I'm not going to beat this into you. I'm going to go through quickly. I got a lot of visuals to keep you interested and engaged, but we need to know where to start, right? This desire of the PPACA, there are a lot of them, right? And I think we all agree that this is kind of how, in the general sense, what we want to do with PPACA. The proponents of PPACA have said these things, right? We want to provide the uninsured with coverage. We want to make sure that we unload ERs because they're bound by EMTLA to treat anybody that comes. EMTLA, right? The legislation that's passed says you have to be treated regardless of ability to pay. The legislation's doing it because there were some stories of people being denied treatment in emergency rooms that later have problems. Desire to simplify paying for medical expenses, desire to control unsustainable costs associated with healthcare. These are all noble things, right? I'm not being facetious. I didn't know those things. So what happened? So the House of Representatives passed a bill called H.R. 3590, which was a bill that was, does anyone know what H.R. 3590 was about? House Resolution 3590. Was it about healthcare? It passed unanimously in the House of Representatives. You don't even know? Because this is the foundation of the PPACA. This was a bill that was designed to give IRS, it was one page bill, passed unanimously in the House of Representatives, one-page bill designed to give tax credits to returning veterans for some home mortgage issues. Okay? So the House passed it unanimously, went over to the Senate. Okay? Remember, we're going to have new taxes, you're going to get the doctor of your choice, you're going to have all this good stuff, right? Senate's driving this train. The Senate stripped out the contents of H.R. 3590 and inserted the language of PPACA, 2,600 pages of legislation. The famous quote, without tribute attribution, although you can ask me offline, you have to pass the bill to know what's in it. So our legislators went in and they passed the bill. Most people hadn't even read it. In fact, the people who really think about this stuff hadn't dissected it out. When it went to the Senate, it passed the Senate under terms of rules called reconciliation. That bill was then sent back to the House, new language, the reconciliation process between the House and the Senate. It passed at about 218 to 201, divided vote. That's a very important thing to remember about this legislation because it was a very much divided vote. So that's how the government runs. They take a bill that had nothing to do with this stuff, stripped it out in the Senate, sent it back to the House for vote, and it was voted on in a divided way. The unanimous bill passed, ultimately passed after reconciliation divided. That's a problem in a society that within moments, at least, well, certainly within the first 15 seconds of passage, one state filed a lawsuit. Within half an hour, 15 states have filed lawsuits against this because of some of the rather draconian things that are going to happen to states to develop legislation. It's been fraught with delays and exemptions, at least 45 exemptions and delays that were assigned by executive order. Exemptions you don't get as individuals, but corporations get. Various congressmen get it, their staffs get it. You know, if you're a congressional staff member, you don't have to sign up for health insurance. You don't have to. It's an exemption. It's given. And it eliminated many options for coverage, including health savings accounts, the right to self-insure without a penalty. Of course, it's not a penalty, it's a tax, right? So, NFIB, National Federation of Independent Businesses, brought suit. All those states, eventually there's 17 plaintiffs in all those lawsuits. They formulated under something called NFIB versus Sebelius, Captain Sebelius, the Secretary of Health and Human Services. Because she's the purveyor and the pusher of this stuff, she has to, and the manager of this whole thing. There's 8,000 growing pages of regulation, as opposed to, in addition to the 2,600 pages of law. She oversees it. So that's what the lawsuit was leveled at Captain Sebelius. Don't worry, Captain isn't going to get sued, right? She's just the head of the Health and Human Services. So they brought that, and what the Supreme Court did was interesting. And there's a lot of commentary about it. The Supreme Court chose to review this law under a legal principle called rational review. Does anybody know what rational review is? Okay, well, what you have to know is in judging, there's some criteria that are done in judging. One's called strict scrutiny. Strict scrutiny says, I'm a judge, you have to make your case about how this is in compliance with the Constitution of the United States, period. The next level will be intermediate scrutiny. It's slightly less rigorous, but still the same principle applies. You have to look at the Constitution and find out how this is legal under the United States Constitution. Now, would you agree that the Constitution is a decent thing to have around? I hope you do, because it's what secures your rights and liberties. It means that human beings don't determine it for you. You're given them by God, your Creator, and they're yours forever, right? Just by nature of birth. So we like to live under those guidelines, the ruling documents of the United States government. Okay? So the Supreme Court said, no, but there's another way of looking at this thing called rational review. And rational review is a juris tool, a principal jurisprudence that says no matter what happens, because these things come out of Congress, what we like to see is that we think the Congress represents the people's will. So we're going to try to find a way as judges to say how the bill would be legal if certain things were changed. The first thing that happened was the Chief Justice rewrote the law, and he said that the penalties described in the PPACA, remember, if you guys remember, there were going to be no new taxes, right? You guys remember that discussion? Maybe you weren't focusing, because it's been a couple years now. But it was a very strong promise. There would be no new taxes. The reason why that was said was because there was no way this bill was going to pass the U.S. Congress if it meant raising taxes. So they were very specific in saying this is not a tax. Chief Justice Roberts said, well, well, any argument I should qualify this. There's something called the Interstate Commerce Clause, which is basically what Congress does in passing legislation now. They say that if it affects interstate commerce, it's therefore the purview of the Congress of the United States, and we can make laws about it. And there's a whole lot of case law that's crazy. You can read about this stuff. But the Chief Justice said, you can't use a penalty on the Interstate Commerce Clause to do this thing. Because what you're saying basically is the government creates a product and then forces the American people to buy it. There's certain things called equal protection under the 14th Amendment of the United States. It becomes unconstitutional in that way. So what Justice Roberts said, well, but the Congress does have the power to tax. It's Article 1, Section 8, right? That you can raise revenue. So if we treat it as a tax, you can do it. Now, that's the judge telling him how it's going to be legal. That's not judging. That's legislation. Because it was specifically said not to be a tax. And that's just it. I mean, it's not Dr. Fredricks, DO, talking about this. This is the senior legal scholars in the think tanks talking about this stuff. Some people have arguments against, some people have arguments for. That's just the legal theory that's going on. So, they also cited, which Anthony Scalia, one of the Supreme Court justices talked about, the constitutional doubt camp, which is you try never to put the Constitution in doubt when you look at legislation in the Supreme Court. You want to try to reconcile the Constitution with legislation, and that's what happened. So now it becomes a tax, not a penalty. And the Chief Justice also had a problem because he said, look, you can't be confiscatory with your taxes. Taxes that become too burdensome and onerous, they're not legal in the United States. You can't do that. So the argument was, well, what is the definition of a burdensome or onerous tax? It was never defined. It was basically like years ago, a guy by the name of Bork, who was up for a nomination for the Supreme Court, asked him what pornography was. And he said, well, pornography, you know when you see it. It was very vague, right? He said that the PPACA tax wasn't so onerous as to represent a true penalty, because you cannot be penalized by the government, not without due process. So he said, right now the way the taxes are, they're low enough that it's not really a penalty. That will lead to other problems in the future, guys, I can guarantee it, because that's going to be challenged at some point. He also said that one of the things that the government tried to do was say that states that didn't agree to form an exchange would not have their Medicaid dollars sent to them. He said, you cannot do that. You can't punish a state for not forming an exchange. The state, this is a good question, what country do you guys live in? You live in the United States of America, you don't live in that country. What country do you live in? Ohio. Under our Constitution, we are the United States of America, state being a very specific term, each with its own constitution, own set of laws and regulations. The U.S. government exists for the purpose of the collective desire to keep rights and liberties that are commonly held by all of us in check and enforced. But the state you live in is Ohio, and that state is a sovereign. Right? That's why we have the 9th and 10th Amendments saying that all powers not delineated in previous parts of the Bill of Rights are reserved for the states. It's a very powerful thing. Chief Justice said you can't penalize states with their Medicaid dollars. Well, that's a problem, because now the federal government can't leverage a state and say, because you won't expand the you won't exchange around, you won't withhold your Medicaid dollars. And then finally, no assessment of legality of the PPACA was made under Article 1, Section 7, Clause 1, which is called the origination clause of the Constitution. That's the clause of the Constitution that says that all bills that are for raising revenue must originate in the House of Representatives. Okay? Why is that? Well, the reason why it is because the House traditionally was meant to be the body of the people. Remember, under the original Constitution before the amendment, Scott, 18th Amendment formed the Senate by direct popular vote. 17th, sorry. This is Mr. Rowe. He's a lawyer, and he's a guy who knows the Constitution far better than I do. 17th Amendment established that the Senate would be directly elected by the people, but before that, who elected the Senate of the United States? The respective state legislatures did. So the way the balance was supposed to be in our country was the president was elected by the popular vote, the Senate represented the state's interests, and the House represented the people themselves. Okay? Which is why the founders thought it would be a good idea. If the people want to raise taxes, they'd have to do it through their own house. That was never addressed, and probably the next argument against PPACA will be made under the origination clause. Because they'll say you cannot start legislation that raises revenue. Remember, this wasn't supposed to be a tax. Now it's a tax. And the tax was not started in the House of Representatives. So that's where the next legal challenges will probably come from. There's several cases working their way through appeals courts right now based upon that. So this is what the exchanges look like. You didn't have to form an exchange. Ohio was one that chose not to. Why was that? Anybody know? That's correct. For the first 2 or 3 years, most states will get a bump from the federal government. But then after that, the federal share of reimbursement starts dropping and states have to match it themselves. In the last decade, how many people has the state of Ohio lost in terms of population? About 2 to 3 million. That's why Cleveland's half the size it used to be, right? That explains that. The state is shrinking. The legislature of the state of Ohio knew that they wouldn't have the base of people to be able to support this thing with the Medicaid expansion. And they were terrified of what their budgets would be because unlike the federal government, the states are required to balance their books. They have to run balanced budgets. If the governor doesn't balance the budget of the state of Ohio, he can be held in contempt and probably legally prosecuted. Again, you can ask Mr. Rhodes specific to that. But the fact of the matter is that the governor's under tremendous pressure to do that. So Ohio said, you know what? We'll let the federal government form the exchange. One of the biggest problems with the PPACA was there was no funding provision for forming a federally based exchange. There's no mechanism to do that. That has to be created. That has to go back to the government to be appropriated with borrowed dollars because we don't have the money to pay for it. Several states created their own state exchanges, and those are working. But what's interesting about this map is you see how divided this has become already. The system was supposed to be one giant, every state would pony up, every state would form an exchange, it'd be a seamless system, right? Hasn't happened. So some of you may have gone on, I tried it myself, to the healthcare.gov. This is all become in the news. You'll see numbers that say $600 million spent on this, and that wasn't. The website actually cost $94 million. Okay? That's the corrected value. $94 million. 3 years to prepare for this. Okay? I got this saying I must have an email address to get in. Now, I know lots of elderly people that don't use email. I know that's a shocking heresy for all you young people, but they don't use email. Okay? Your account couldn't be created this time. System crashed. This one has this example of 3 different very distinct passwords, and the response was your passwords can't be the same. And then, of course, the system was overloaded. Curiously enough, there are 9 million hits. So far, 30,000 people have been able to successfully apply for insurance. And to put this in perspective, Southwest Airlines flies 3,000 flights a day in this country. If you say an average number of people on board those airplanes is 100, you're looking at how many people flying every day in this country? 300,000. And yet, Southwest Airlines is able to run a website that doesn't fail, doesn't crash, allows people to get cars, get hotels, buy airline tickets. It does it just fine. So the question that's being asked now is, how do we spend $94 million on something you anticipated for 3 years, and this is what happens on the first week of you doing this? No accountability. No one getting fired over it. I guarantee you, if Steve Jobs had people working on a website that he put out there, had 3 years to prepare, spent $94 million, and the target was, we want to have, basically 20 times 30,000 registered by this time in October, and they didn't have it, do you think people will lose their jobs? I can guarantee Steve Jobs would fire his entire IT staff and start again, because they couldn't produce on something that had to be monetized. They'd lose their jobs. Hasn't happened, right? This is the public approval. This is, of course, a little dated because I pulled this off on the 2nd of October. This is the divided law. Now, obviously, you've got 40%, somewhere between the low of 36%, clear up to 42, 45% in favor. The point is that I don't have a problem with PPACA. I'll be honest with you, I don't. What I have a problem with is coercion. I have a problem with the one-size-fits-all solution for a country of 360. I have a problem with a country that has 316 million people having one choice. That's my problem. This is how divided we are. Another way of looking at it. This is Real Clear Politics, not notably right-wing hack website. Okay, this is pretty good. They average all these polls. And this is what we got to look at. Remember, our desire was to help the poor. Now, I've been in poor countries. I've been in countries where people pay for private education. And I'll talk about this in a second. People pay for private education for their kids at $1 a month. And they get a private education. Okay? Abject poverty. Well, this is what poverty looks like in the United States. 40.7% of people who are defined as poor own their own homes. This is the number of percentage, and the list is quite much longer of people who have amenities, right? Now, I'm not saying it's bad to be, it's a good thing to be poor. I'm saying that when we look at the poor in the United States of America, we have to be very careful. We can't just deal in anecdote. You can't just adjust entire social systems based upon a desire to help one or two people you know who got a bad way. You have to look at what you're really doing. I see people every single day. Now, this is anecdote. I don't know many poor people that don't have smartphones. I don't know many poor people that don't drive cars. I don't know many poor people that don't have a place to live. And I'll tell you what, what's really interesting is you look at living space. Now, this is the poor average living space, 2,400 or 2,100 square feet. This is all of European people, not just poor people. The average living space in the United Kingdom for all people, not just poor, 915 square feet. Their energy is hugely expensive. Their cost of living is hugely expensive. But in our country, the poorest of our poor can live in homes that average 2,100 square feet. We need to keep some things in perspective. Again, with the noble and laudable ideas of helping those in need. I've done it. I've lived it. So you guys can throw any darts you want at me, but I've actually done it. I've gone into villages with people who had nothing and done everything I could to help them. But you have to assess them from the place that they're at and look at what they can do for themselves. This is the current status of how it's been projected that people will save money in the health insurance exchanges. You'll notice that the blue represent states that will see a savings in their insurance. There are only 5 states that will see net savings. In the state of Ohio, you're going to have, for a family of 4, an average savings of minus 0.4%. That's the reduction in their total premium with the new exchanges. And the whole law and the expansive regulatory burdens have come. You'll notice that in every state that is not blue, rates are going to go up. This has been projected. This is nothing new. The actuaries talked about this. This is the impact of this legislation. I told you, you can't own a health savings account. You can't self-insure without taxation. If you've got $2-3 million sitting in the bank, and you say, I'm going to self-insure, you have to pay the tax if you choose not to buy insurance. Right? It's important. Now, what's the explanation for the blue things? So the blue things are largely explained that these states had poor regulatory structures for their insurance programs in the first place. Right? So a state like Colorado, which sees for an individual young person, a minus reduction of 30%, that's because their state insurance regulation was horrible. They couldn't get things done. But I'd say a net gain of 5 states that see improvement in their premiums, that's not optimal. What are employers saying? Well, you understand in states that didn't form their own insurance exchanges, you know that employers are not required to provide health insurance anymore, and they don't get penalized. The law is written in such a way that if the state doesn't provide health insurance for their employees, and they live in the state, their employers live in the state that did not form exchange, is in my mind. You have to pass it to find out what's in it. You would have thought that if you really wanted to get people, the fire under people to do this sort of thing, you would have thought that through a little more. Because states are individual sovereignties. They have the right to opt out. So this is what employers are saying. Are they going to hold off hiring? Right? This is a Gallup poll. Again, Gallup is not a right-wing libertarian think tank, okay? This is the impact it's going to have on our economy. At least right now. Remember, I talked to you in snapshots. I don't need additional employees. Worried revenues, just look at this down the road. Don't know what's going to happen. Worried about government regulations. This is not the big fat cats of Chase Manhattan Bank. I mean, this is the mom and pop business that runs 10 employees, 15 employees. Most of small business in this country. Under 50, you are exempt. So if we look at employers, right, this is Wells Fargo Gallup again. What are they going to do as far as overall numbers of jobs and positions? Are they going to increase or decrease? Right now, they're saying we don't plan on increasing at all. In fact, they'll probably decrease their total number of employees. This is the book I was referring to. This is an interesting book that you guys might find interesting. It's about education. This is about how people in the poorest parts of the world send their children to private schools for $1 a month, called Beautiful Tree. This was commissioned by the British Education Department, basically their equivalent to the Ministry of Education. They thought that Thule was going to find all sorts of problems with private education. They went out and did research all over the world as far as how do the poor pay for things. His research is fascinating because he had a case in India where he had a woman who couldn't pay her tuition. She was 5 months behind. 50 rupees, about $1 per 50 rupees. So she was 5 months behind, about $5 total. He said, I've got 500 rupees, I'll give it to you. She said, I don't want your money. I want to pay for my own, I want to take care of my own children. There's an issue of pride for a lot of people to say, I can take care of my own. I'm poor, don't patronize me. Terrible thing to do. You don't do that in Iraq either. It's a great book. If you want to look at, can the poor afford to get things they would like to have? Yes, they can, if the priority is there. That's Thule's research, so I bring it up. Okay, so physicians, what are physicians doing? So, you know, I can go on at length about this stuff. I don't want you, because it's late in the day, you guys are tired, you're beaten, now you're going to have the, alkaline tide hit you and fall asleep. But what are physicians doing? You notice that a small but growing number of U.S. physicians, this Wall Street Journal data, are opting out of Medicare. I heard a physician just 10 minutes ago say, if you're not Medicare or Medicaid, you can't practice medicine. That's absolutely not true. And doctors realize it. More and more, they want to opt out of Medicaid and Medicare. Now, what happens under PPACA if you meet certain guidelines as far as qualifying for health insurance? What are you allowed to do? Remember the whole argument was expansion of Medicaid, right? You can go to Medicaid. That's the program that you get opted into. Fewer doctors want to participate in it because they know money's fungible. You can't just make it out of thin air or the Fed can, okay? 17 trillion and growing of debt. There's printing money, it becomes devalued that way. The problem is that you can't just create it out of thin air. So eventually what's going to have to happen is this. Either we shut down the Medicaid programs, which truly do help some people, okay? Or we stop reimbursing doctors, or reduce their levels of reimbursement. And either way, if you stop physically giving the same amount of dollars, you reduce it from $30 a visit to $20, or if you give them $30 that are devalued through printing it, if you understand that, you print more money, money to back it up, it becomes less valuable. It doesn't matter, the outcome's the same. Doctors see more patients to pay the bills. This is a terrible outcome that's occurring because doctors don't want to put up with it anymore. So they're leaving. These are states right here where concierge practices, you go out and contract for independent services. People pay $50 a month, bill $180 a month. You go to their doctor, you give them your cell phone number, you see 300 to 400 patients in your panel. I see an average of 35 patients a day. In 10 days, that's my whole panel, right? If I'm a concierge physician. Do you think that's not within the doctors to be able to get paid cash without any billing overhead? It is. What are the prices of this? I told you what's affordable. The average concierge practice, if you look, it ranges from $51 a month to $225 a month. That's this chunk of that graph. So in this country, across the board, and we're not extrapolating or stratifying throughout states or counties, but concierge practices are charging anywhere from $50 a month to $225 a month to their patient panel, and you get unfettered access. That's all you pay, just the doctor. You're a primary care doctor. You have additional tests and stuff, it's usually more money, right? But $50 $50 a month, and you have your doctor's cell phone number. Doctors find that appealing, patients find that appealing. That's a different market. It's emerging. So, this is a study I brought up for you guys. This was done by a legal firm that talked about this. This is in the Journal of Health and Life Science and Law by 2 attorneys talking about that as concierge medicine proliferates a wider range of practice models and free structures to make this approach more affordable and lower middle-income patients and help satisfy the need for greater access to preventative care. Healthcare policymakers should take steps to encourage this outcome. Greater choice, greater access. However, states that have a vested interest in collective care have decided that they're going to start coming down on concierge physicians. Now, what they're trying to do is they're trying to make concierge physicians register as insurance companies, which means you'll have to be in full compliance with the state insurance boards and regulatory framework of the insurance industry. What solo practitioner can do that? Very difficult. One benefit of that, of registering these practices, is we get accurate data of how many patients. In this particular case, there were 24 practices. This was actually in Oregon, 24 concierge practices registered, serving 10,525 patients with 0 complaints. That's a market, you guys. That's people that found something they wanted, spending their money for it. So as we close up here, I'm going to go through a few more slides. This is the thing that really concerns me. This is about our budgets, right? These are CBO projections of where our budget's going, what our current debt will be. Right. Currently, our budget is approaching, somewhere between 25 and 30% of our GDP. So every dollar earned in this country, our federal budget is approaching 30% of that. That's what it's taking. So if we create $17 trillion a year in services in this country, we're approaching close to 30%, $4 trillion, $4.5 trillion just to run the federal government. It's unsustainable. This is what Social Security looks like, right? And Medicare. When the program started, you had 5 workers supporting 1 individual recipient. Now we're down to 2. What happens when you have 1 worker trying to fuel the 1 recipient on Medicaid or Social Security? It's not sustainable. This is a picture that shows what we spend our money on in this country. Okay? You guys, the government shutdown, how many people think that we would have defaulted on our loans if we had passed the continuing resolution? You heard that in the news? The president's actually would be in violation of the law if he defaulted the loan. The debt service on our debt is $30 billion a month. We're going to take in $2.4 trillion in taxes this year. But the government wants to spend an additional $1.3 trillion in its budget. So we have all the money necessary to pay the debt. And in fact, we actually have all the money necessary to pay Social Security and pay Medicare, and we can even pay our national defense if we need to. With the $2.4 trillion, if all the smoke and mirrors crisis that you heard in the news, you can't default on the debt legally. There'd be a constitutional crisis if you did that. And it only is $30 billion a month. I'm not saying it's a good thing, I'm just saying there was no risk of default. Because the president has the discretion to do it, he's legally bound to do it, but because it's his discretion to pay the bills, he was threatening. Now, what's last, you look at what does socialized healthcare go? Well, the only study right now out is called the Oregon Health Experiment. The interesting thing about it, you can read the bullet points, but basically, there is greater access when you have universal care. People go to the doctor more. That's expected. You make anything less expensive, people use it more. Typical supply and demand, okay? But look at the outcomes. There is no significant difference in measured blood pressure, cholesterol, glycosyl, hemoglobin. Those 3 parameters were measured for greater access. No statistically different in patients who were in the program or patients who weren't. They can go to the doctor more, but they change their habits. Not appreciably. This is an ongoing experiment. It's going to be prospective. So this is the first 2.5 years of data. This is Massachusetts. This was just, forget the date on this, October 13th. Editorial, why is it so hard to find a doctor in Massachusetts? We all hear about how Massachusetts, how well they're doing. They have their access problems too. They can't find doctors. People who want to find a doctor can't get in. So what's the future? Again, I told you that my bent is choices. If you want to be in the PPACA, you want to be in the exchange to get the system running right, you don't feel, oh, by the way, there's no protection of your information on the site. They tell you that in their user agreement. So whatever you put in there can be exchanged to any government entity they want to. Okay? I'm just saying, if you want to be part of the PPACA, you want to be on the insurance exchange, do it. If that fits you. Divided people, divided government, constitutional challenges, I told you about the legislation, reduction in providers, lower quality care potentially. There's only 2 studies I know of that actually compare PAs to nurse practitioners in terms of quality care delivery physicians. They're both done by the military. There needs to be more studies done on that. There's not much on that. But basically, both studies concluded that a nurse practitioner and a PA can do your job as a general practitioner as well as you can. What do you think that means? You got a $250,000 debt. Who are you competing with now? Eventual collapse of the system. All of these places that have socialized medicine, you think Great Britain, their NHS is great? There's 2 tiers of system. If you want to get here, you can get your hip fixed. It'll take 6 months to get in. Or you can go tomorrow with Blue Cross Blue Shield. 2 tiers. Bulgaria. You want to go to Bulgaria? Socialized medicine. But if you want your baby delivered in a clean hospital with a good OB, you're going to, as I did for a friend of mine, I'm going to send them an otoscope, I'm going to send them a whole bunch of other products, because that's how the physician was paid. Okay? So there will automatically be 2 tiers. Why will there be 2 tiers? So some people don't want to wait in the line. Some people want stuff now. That's what choices offer you in the market. Okay? With a tax lower than the premiums and no pre-existing condition clause, why would you even buy insurance if you just want to pay the tax? Because as soon as you get diagnosed with cancer, there's no pre-existing condition clause, you just go in and sign up for insurance, right? If the tax is lower than the premium, why would you ever pay the premium? What happens when we don't pay the premiums? What happens to the insurance companies? They go out of business. They're depending upon a shared risk pool of regular premiums to cover their covered lives. If you don't sign up, you're just going to pay the tax. There won't be an insurance company to go to when you have a problem. Remember, I told you only 30,000 people signed up for insurance so far. So what are the solutions? Let the system proceed. Find out. I mean, every socialized company in the world has this system. Let's see what happens to us. It's law. It's been passed. It's been interpreted as law. We don't have a choice. We got to kind of watch this thing as it goes. Figure out the real question about why we have costly healthcare, not just the one seen through DC's lenses, and explore the greatest breadth of care at the lowest level. I don't like the term family practitioner because I think it's confusing to patients. I like the term general practitioner. And if you guys are all trained in your breadth and generalism, you can offer the greatest amount of services to your patients. The lower we get to point of care service with ultrasound, with other technologies, get those things cheaper, that's less cost to the patient having to go to a hospital. I'm all for that. The widest amount of training, set and fracture. Do all stuff you don't have to send patients to more expensive care to. We should do that. Demand total transparency and access to costs. Teach you guys how business actually works without overhead and how you have to pay bills. You guys don't get any of that education. Believe me, I've tried. I've tried to tell them, give me 5 hours on how do you get paid as a doctor. No buying. This is the really interesting question to me. This is the United States of America. This is a data, this is National Geographic data 2 years ago, $7,800 per life per capita for healthcare expenditures per year. And if we get 75 years of life expectancy, and there's all these socialized countries in here, and they all say, look, all these countries have lower costs and higher life expectancies, but then I always want to look at Mexico. $825 a year per person under fee-for-service, and their life expectancy is only 1.5 to 2 years less than ours. How do they pull that off? How do they give fee-for-service medicine $825 a year per person, and have life expectancy only 2 years shorter than ours, and longer than some countries with socialized systems? We don't ask that question. Why aren't we asking that question? So, I guess I would conclude this by saying that if you're going to solve a problem, complicating it isn't usually the best way to go. Anybody know what Occam's razor says? Who knows what Occam's razor says? What's Occam's razor say?
Simplest explanation.
Yeah. The simplest explanation is usually what you need to solve a problem. Now, I'm not saying healthcare is not complex. I'm saying, though, I think we can do it better. You want to know what the PPACA is right now? It's law. As of February of next year, you're going to find out whether or not you're going to pay taxes and penalties, or people you know. Okay? The data I have is dated as of this week. Will it change? Inevitably. Will utilization go up on the website? Yes. Will they work the kinks out of it? Hopefully. Even Robert Gibbs, the former press secretary, says it's a debacle, the website. It's horrible as far as how it's come about. Someone should be fired. This is Robert Gibbs of all people. He's not known for his right-leaning tendencies. I mean, it's a mess. What you guys need to know is this, and I'm going to leave you with an encouraging thought. This is North Korea, okay? This is South Korea at night. This is a Marxist socialist state, autocracy, 100% One size fits all, one choice. Lights in Pyongyang. That's what a socialized state looks like. I showed you parts of Eastern Europe back in the 80s, it looked the same way. This is what happens in Western society. It's a very famous photograph, okay? It's a symbol of what you want to live in. Do you want to live in a country that says you have one choice, it's all determined by bureaucracy? Or do you want to live in a country that says, hey, we've got the bureaucratic choice. There's Medicare, Medicaid, there's the PPACA provisions, but you can also go fee for service. You can go a lot of different options. And the people who truly study this without agenda to say, what is the most cost-effective solution for delivering care at the lowest cost to the greatest number of people? You're going to have to wait to find out, but you'll know. I tell you, by May, if we have a conversation, we'll have a much firmer idea about how this all shakes out. Okay, I'm happy to